Greetings! Welcome to another lecture for Counseling 5480 Diagnosis and Treatment Planning course. In this lecture, we're going to talk about paraphilic disorders. As usual, before we explore paraphilic disorders, I'd like for you to take a break and think about the following questions. Number 1, who or what defines what is normal sexual expression? Number 2, how do you define healthy sexual expression? Number 3, how can you better understand how clients' definitions of healthy sexual expressions are? Please feel free to share your answer on the Jamboard, which is the same Q&A Jamboard link, but on page 2. For those of you who've never heard of paraphilic disorders, you probably have heard a little bit about paraphilia. So what is paraphilia and how is that different from paraphilic disorder? Paraphilia refers to the persistent sexual interest in things other than having sex or foreplay with physically mature, consenting human partners. And this feature is also shared by paraphilic disorder, right? People with paraphilic disorder always have recurrent and intense sexual arousal as manifested by things such as fantasies, sexual urges, or specific sexual behaviors. But paraphilic disorder is above and beyond paraphilia. So first one, or one of the ways is that there is a requirement for the duration of all the symptoms for paraphilic disorder, which in this case is 6 months or at least 6 months. Another difference between paraphilic disorder and paraphilia is that individuals struggling with this disorder, they actually experience distress and impairment in their daily functioning. So the individual will act on these sexual urges, maybe sometimes with a human being, but they did not give a consent, or their actions have caused anxiety, guilt, shame to themselves, to other people, and they may also experience impairment in their important areas, including their own sex activities. This can also include causing harm to the other person, especially if the person did not give the consent. Now that we have obtained some basic understanding of paraphilic disorders, let's look at the specific type. The first one I'd like to talk about is voyeuristic disorder. People with this disorder, first of all, they have to be adults in order to receive this diagnosis. And people with this disorder experience sexual arousal from observing an unsuspecting person who is naked or getting naked or maybe having sex. And so activities include them watching people taking a shower or filming another person without their permission. The next one is exhibitionistic disorder. People with this disorder experience sexual arousal from exposing their genitals to an unsuspecting person. And for this specific disorders, we can specify if the unsuspecting person is prepubertal children, or physically mature individuals, or both the prepubertal person and physically mature individuals. So there are 3 specifiers that you can use. And these specifiers can actually help us to identify those who potentially also have co-occurring pedophilic disorder. The next one is futuristic disorder. People with this disorder, they experience recurring sexual arousal from either touching or rubbing against a non-consenting person. So this usually happens in a very crowded area, such as like a public transportation or in a bar. The last two on the slides we're probably more familiar with based on media. They are sexual masochism and sexual sadism. So, sexual masochism disorders, individuals with this one, they obtain sexual arousal from the act of being humiliated, beaten, being bound, or otherwise made to suffer. And people with sexual sadism disorder is the one who result in the sufferer. So they obtain sexual arousal from the physical or psychological suffering of another person. Next, we have pedophilic disorder. In order to receive this diagnosis, individual has to be at least 16 years old. These people have sexually arousing fantasies or sexual urges involving a prepubescent child that are younger than 13 years of age. And the individual needs to be at least 5 more years older than the child. People with fetishistic disorder have sexual arousal from the use of inanimate object. It could be anything. It could be shoes, could be pens, it could be book, could be panties, bras, boxers, or they have a highly specific focus on a congenital body part, such as feet. And the last one we have here is transvestic disorder. Individuals with this diagnosis experience sexual arousal from cross-dressing. But I like to make it very clear that not all cross-dressing people have this disorder. It would only become a disorder if the activity is accompanied with sexual excitement, the individual is emotionally distressed, or the activity has impaired their functioning. It's important to note that not all paraphilic disorders involves causing harm to others. On the slides, you can see two columns. The left columns, I put in 5 disorders that usually involves causing harm to others, whereas the other columns, there are 3 disorders that don't involve any harm to others. At this moment, I also like you to pause this lecture and jump on the YouTube link I shared on the slide so that you could understand a little bit more about how someone is in love with his car. In general, research on the treatment of paraphilic disorders is unfortunately very limited, and most of the studies are conducted with sex offenders. The goal for the therapists or treatments within those research is usually to reduce recidivism in sex offenders. There are 3 modalities I'd like to talk about today. The first one is CBT. So, CBT therapists working with sex offenders by providing social skills training, teaching them cognitive restructuring. There's also the emphasis of developing victim empathy and imaginal desensitization. The second modality is called relapse prevention therapy. This one doesn't have a specific like counseling theoretical orientation per se. It's more of like a combination of evidence-based dynamic factors such as intimacy, attachment, emotion regulation, and impulsivity, as well as the focus of the therapeutic relationship. And the last modality is psychodynamic therapy. This one is has been used, but it's not evidence-based. As you know, psychodynamic therapy focuses on the exploration of intrapsychic and interpersonal dynamics. And in this circumstances, this therapy, psychodynamic therapy, has been used to kind of understand the individual's paraphilic behaviors and fantasies in relation to their personal history and their current relationships, including their relationship with their therapist. In other words, therapists using psychodynamic therapy to kind of understand the roots, the origins of these paraphilic behaviors. So, psychodynamic therapy is usually used for case conceptualization, but not so much for the intervention, if that makes sense. If you are having some questions regarding the treatment of sex offenders, I encourage you to write them down so that you would have a chance to ask our guest speaker in the upcoming class meeting. So Miss Stacy Ulrich will come to our class and talk about her previous work as a sex offender treatment provider. She's also a licensed professional counselor with a rural private practice. I have some of her background listed on the slide, so feel free to read about it and so that you can have a better, meaningful communication with her. And with that being said, you have reached the end of this lecture. I'm hoping that you find some of the information for the lecture to be complementary to your readings for the week. And as usual, please don't hesitate to ask your questions on the Google Jamboard or email me or stay after class. I'm more than willing to talk to you. Bye bye.